From breakthrough strategies to game-changing innovations and cultural shifts, you'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today, I'm excited to welcome Dr. Munir to the podcast. Dr. Munir is a board-trained psychiatrist and medical director at Boston Neurobehavioral Associates, where he leads outpatient mental health services with a strong focus on evidence-based care, compassionate treatment, and real-world outcomes. With over a decade of experience in psychiatry and behavioral health, he's known for empowering multidisciplinary teams, strengthening patient-centered systems, and helping people and families navigate some of life's most complex challenges with clarity and dignity. Before stepping into his current leadership role, Dr. Munir trained as a resident physician at St. Elizabeth's Medical Center and also contributed to the field through work in addiction services and clinical research, including time with Cambridge Health Alliance and Dartmouth's Center for Technology and Behavioral Health. In this conversation, we'll talk about what high-quality mental health care really looks like today, what's changing, what still needs to change, and how we can build a healthier community through better access, better collaboration, and better care. Welcome to The Missing Piece, Dr. Munir. I'm happy to have you.
Thank you for having me. Appreciate it.
Really looking forward to this conversation. I want to start from the beginning. I mean, how did you get to where you are today, the role, that you serve, but introduce yourself. Who are you? And tell us about yourself.
So I am actually technically a college dropout. I went to Boston University for a couple of years, and I was sort of at an impasse in my life where kind of going through a lot of things personally. And my father, who's also a psychiatrist, he would always sort of kind of encourage me to pursue medical school in Pakistan, where he's from, right? And so that's where he did his training, of course, and then ultimately came here and took the licensing exams here and was able to ultimately get to where he is today. And so he was sort of encouraging me to sort of take that same route. I used to laugh it off for a long time, right? Because it's sort of like a big change, right? To kind of grow up in sort of the suburbs of Boston in a very kind of privileged upbringing and then make a transition to the third world. But I was at such an impasse that on a whim, I kind of made the decision to leave BU and go to medical school in Pakistan, which I did. And I always knew I needed to be, or I wanted to be, a physician. So that wasn't really a difficult decision for me, but it was the actual act of kind of packing up and leaving the country for a number of years. So I lived in Karachi, Pakistan for 5 years. It was sort of a hybrid situation, between living alone and living with family, whom we have, a lot of there. And then once I got back, I did an exchange clerkship through Harvard Medical School. And that was in outpatient addictions, right? So that's where I got my real first exposure to psychiatry, because in Pakistan, the challenges are different. People are dealing with things like poverty and infectious disease more so. So psychiatry, at least at that time, was not at the forefront. So that was my first real exposure to the field. And ultimately, that's where I really realized that, my interests aligned with my strengths in that sort of world of psychiatry, because I got positive feedback from staff, positive feedback from the patients that I was working with. And that's when I made my career decision, right, to kind of follow this path. Of course, my father, he always sort of would push me in that direction. You should think about psychiatry. And of course, as any young man would do, I disagreed with him and thought that I would go the internal medicine route and maybe become a cardiologist. But really, fate kind of brought me to that realization that I should become a psychiatrist. And then from that point forward, all my efforts were focused on achieving that goal. And I don't know if you know this, but for international medical graduates, it is very difficult to kind of make it in this environment, right? Because you're competing against other local medical grads that maybe have high scores on their exams. So you have a couple of different things working against you. So, I focused on kind of building up my CV. That's why I did that sort of research assignment with Cambridge Health Alliance, got my name on some paper, right? Made a lot of good connections. And ultimately, I consider myself to be very fortunate to match into a residency program in my home city, right, which is Boston,
Yeah.
right, and so St. Elizabeth's was where I trained, and then my dad, he was recruiting me from day one. He was like, you need to come work for me for whatever reason. It's a good opportunity, and so on and so forth. And of course, as any young man would, I fought him on that as well until the way that he secured my services was I was in my last year of residency, and I was interested in be doing some moonlighting, right, and seeing patients. And of course, residents don't make good money, and I was married at that time. I had already had one child. I mean, financially, I could use the extra money, so that's where I decided to moonlight with him, and I started to build my caseload very organically. And of course, at that point, I was already used to that sort of role, and I knew that I wanted to do outpatient as opposed to inpatient, and that's when I decided to sign on with Dad full time. And very quickly, I became sort of the face of the clinical operation, right? And now we're sitting in a place where we have almost 200 clinicians, and they're sort of all under me, and I'm managing them. But of course, I have a lot of help from my director of operations, my director of marketing, my father, who's sort of the president, still the president of the company, and my mentor, and I have a lot of good help, but I've been doing this for the last several years.
Wow, there's so many things that I love about that story. I mean, the fact that you started by, being a college dropout, like right away, I'm like,
Right.
okay, tell me more,
Right.
tell me
Right.
more. But what a neat story. And isn't it true that we have, young listeners that are studying primarily medicine or healthcare IT related fields. And they love hearing these journeys, and to where sometimes we don't know as young kids, or our families tell us, what we're supposed to do. But I love how you were saying by fate and by circumstance, and then just kind of your journey along the way is, and how you got to where you are today. And now a family run business. I mean, working alongside your dad, I'm sure he is just thrilled for that as well, and have grown into the organization that you guys have today, which is remarkable. Getting more on the personal side of, becoming a psychiatrist, growing, this organization that your father is leading, and now what drew you outside of, necessarily fate? I know you talked about addiction, but even, that human aspect and of behavioral health. Was there like a moment where you were like, this is my calling. Like, this is how I can make a massive difference in patients' lives. This is where I know I'm supposed to be. I mean, yeah, you could have become a cardiologist or a heart surgeon, but was there a defining moment on a personal level where it just, you knew you were going to make an impact in patients because of
I,
behavioral health wing?
I mean, I think, and I'm going to go back to a little tidbit in my original story. I think that the defining moment for me was that rotation that I did at Cambridge Health Alliance, right? So during that rotation, I not only got to work with patients individually, but I was also running groups, right? Where we were doing sort of group sessions where patients get together and talk about their struggles and problems. So not only mediating them, but giving them feedback and sort of helping them along in their struggles and problems. And this was before I had any formal training, right? And to be in that environment, and then to really feel comfortable in that environment without having any sort of formal training, and then to get sort of rave reviews from the staff that were working there, from me, and then also the patients. I think that was what sort of sealed the deal for me, was getting that exposure and having that type of feedback. So for the young people listening, right, what I would encourage any young person to do as they're sort of navigating their career or what they want to do in life, I would encourage anyone to really find where the interest aligns with strength, right? And that's where I think that's where really, I mean, for lack of a better way to put it, the money is made, right? Is when your interest aligns with strength and you truly love and you enjoy and you put your passion into what you do.
I love that, Dr. Munir. And I think I 100% agree with you. I mean, even in my career, when you wake up excited, when you just know that this is
Right.
what you're passionate about, when you know the impact that you're making, you just know. It's almost like a knowing. So
Exactly.
a little bit more just to feature Boston Neurobehavioral Associates. Do you feel like you guys have some unique approaches to patient care and mental health that you're doing that's moving the needle, or that maybe is the missing piece in your practice, instead of, maybe what the rest of the country could hear or learn from, or things that Boston Neurobehavioral Health is doing differently?
I think that this answer to this question really goes back to when my father started the practice, like almost 30 years ago, right? Where he was very committed. And of course, I credit him for really digging down and shedding blood, sweat, and tears in building this practice to where it is now. But his philosophy was always never to marginalize any population. So we are unique as a private practice in that we don't see just one sort of group of or one demographic. It's everybody from self-pay to Medicaid and Medicare. And what anybody that knows anything about insurance in this environment will tell you that the public payers pay less, right, to us for the services that we provide, right? So that's a reason that a lot of private practices do not take public payers, right? But I think that the way that we have really been able to be a service to our communities is not discriminate with respect to insurance, right? And so there are some people that don't have insurance and prefer to pay out of pocket, and we of course we accept that, right? And there are some people that are on public plans like Medicaid and Medicare, and we accept that, right? So there's not a single insurance that we don't accept. And I think that is our biggest strength, is that, of course, we have to have a certain business model to be profitable while we're getting paid less. And we've managed to accomplish that. But the biggest service that we have been able to provide to the community is not to kind of pick and choose who we're seeing, right? Which is unfortunately the reality with a lot of these private practices.
Right. That's incredible. That's incredible. And what an asset you are to the community because of that, basically. Doors wide open, and not limiting that. That's awesome. Switching gears, AI in behavioral health. Curious if I'm sure you're constantly doing reading or research or learning about all the buzz around AI, but it's unbelievable how fast and rapid AI is infiltrating not only the market, but even the healthcare space. Curious your thoughts on AI in healthcare, in your practice, current, future. Yeah, where do you sit with it? What do you think?
I mean, I think in terms of the therapeutic alliance, right? I think AI is very sort of limited in what it can provide, right? For example, if I have a patient, that patient is not going to have the same type of relationship with a robot that the patient can have with a human being, right?
Right.
So I think that part of it is limited, and there's still some research going on with that. That said, in everything else, right, in the management of the practice, right, in everything administrative, in optimizing workflows, so on and so forth, I think if you're not actively trying to tap into AI, then likely your business is going to lag behind, right? And that's the reality of it. Even in our clinical workflows now we have a business associate agreement with an ambient scribe company, right? So now our providers have this option. And again, it's an option and it's something that I use in my own practice in seeing patients we have a tool that can transcribe our entire conversations with our patients and generate a note, right? That we can just copy and paste into our EMR. And it saves so much time, right? And of course, I mean, with the caveat of you still have to go in and you have to fact check the note and make sure that everything is accurate, but it saves so much time from an administrative standpoint. Similarly, on the back end, so that's something that's directly provider facing. But on the back end, we're leveraging AI to generate different types of reports right from our EMR to sort of optimize, our office utilization and the way that we are looking at our metrics on a day-to-day basis. We're leveraging AI to audit charts and see where our coding is falling short, or even if there's an example of upcoding. So there are numerous ways that you can leverage AI to support your business. And my mindset is to, as well as others within the organization and upper management, is to bring BNBA into the future, right? And we will not be able to do that without leveraging AI. So I mentioned a few different ways that we are actively doing that, but we're always exploring new ways, not to become more efficient, but also to save money, right? So you can utilize AI for both of these purposes, and I would encourage any business to do so.
I love that. I had no idea, we hadn't talked about this before. I didn't realize that you guys were tapping into it so much. And I completely agree. I think the more you know, the more excited you get about the efficiency, the accuracy, the complexity, the data, the intellect. Yeah, these ambient scribes are unbelievable these days. And even the security behind it. I know there's been those security concerns, but the way that, security has been built into, the tools is remarkable. So I agree. I highly encourage people to leverage AI. I do agree that if you want to be a growing and thriving practice and be able to offer the best, really leveraging some tools is going to do that for you. And it sounds like that's exactly where you're kind of leading the team as well. So you had mentioned you have 200 people, I think, under you or that you manage. So clearly your organization, your association is growing and thriving. When it comes to culture and training and management of that, what are you doing specifically, to create, a culture of learning, a culture of probably, I don't want to say family, but, a family feel and an impact on the organization currently? How are you pouring into so many people and making sure that you're aligned?
That's an excellent question. I think that the reality is that when you're responsible for that many people, and also you have so much to do, right, it becomes difficult, right, to keep tabs on everybody. That's why I think having middle management is very important. So I think that when I first started out, there was this concern that BNBA was sort of very much kind of turning into a corporate show, right? And that's not what we ever wanted, right? So one thing that really helps me and something that I put in place is that if there's ever a change that we want to make as an organization that is provider facing, right? Or even admin facing, right? That we give ample notice to everybody by email, through middle management, right? And make sure that we don't make any sort of changes on a whim and just let people know after the fact, right? And what that accomplishes is that it allows people to feel like they're not just workhorses, that we actually value them and that we are keeping them in the know about everything that we're doing, right? And I think that that's very, very integral to our operation now. And if we look at our own numbers, right, just in terms of the way that we handle middle management, the way that we sort of notify people about certain policy or protocol changes that we're making. I mean, it's reflected in our provider retention, right? There was a time where we were going through a sort of a kind of a transition period internally, that there was a lot of turnover with providers, and now we've gotten to the point where there's barely any, right? And I think that speaks to the way that we have tried to preserve as much of a family culture as we can, being as big as we are.
I love that. It's true. I mean, I think that is, everybody does want to have this feeling of culture, but it is hard when you are scaling. It is hard, when you're hiring quickly and when you're still seeing patients. And I mean, in any organization. So going to like leadership and scaling, and I mean, huge success. I mean, huge congratulations to the success that you guys have, because it just means you're helping so many more patients, in your community, which is amazing. That's really at the end of the day what it's about, with scaling and leadership. What, as a leader and a physician that's still practicing and seeing patients and growing, what are some of the pain points or gaps that you continue to feel like you come up against in your leadership role?
Well, here's the thing. I think the reality is that you are not always going to be able to make everyone happy.
Yeah.
And myself, just
You're
on
not, come on. Like,
myself, just being who I am by nature, right? I grew up very much a people pleaser, and I'm still that way, and I'm working on it, right? The reality is that, in terms of what I struggle with, that still to this day, is to consistently, basically be very consistent with our processes to a point that it doesn't bother anybody, right? I can, for example, just give you, like, I just talked about basically giving employees ample notice when we are sort of making any sort of major change, or we've made a decision, right? So, I recently went into this situation with our sort of therapist team leads, right? Where we're kind of struggling with the new CMS guidelines, and CMS guidelines requiring people to come in person for a visit, every year. And of course, basically the fallback was, we do a little bit of research, we have another discussion together, and we come to a decision. Whether I disagree with middle management or not, ultimately there's a hierarchy there. But sometimes so many things are going on at once that things get lost in the shuffle, and maybe a correspondence goes out before that conversation even happens, right? And I think that what I would really encourage anyone in an upper management role to do, or that is interested in joining any sort of upper management role, is to really have an airtight task management system, right? Where you are keeping track of everything that you're doing, you're following up on it, you have your team sort of in on it, at least the key members of your team in on it. And to me, that task management system that I use, although it's gotten a lot more streamlined over time and it's getting better and better and better, there's still some gaps and some breakdowns in communication when you're dealing with so much at once.
Yeah. I love that. I love the whole, when you were starting with like the whole people pleasing. I think we all have weaknesses, and when we can identify them as leaders specifically, then we'll know how to move forward. And then you explaining what needs to happen, even from a task management perspective. I love that. So putting on your physician hat and taking kind of off your leadership hat, curious on, rating where we're at from a mental health perspective. Where are we doing things right, and where are physicians maybe missing the mark? I'm curious on your opinion, as a doctor that sees, mental health every day.
That's a really good question as well. As somebody that has now seen sort of patients back to back for a number of years now outside of residency, right? I think that as physicians and as mental health professionals, there is, because of the environment that we live in, and even within our own environment, our own internal Boston neuro environment, right? There's pressure. There's pressure to see patients and see volume, right? And that that pressure or that volume is directly tied to compensation and financial growth and so on and so forth. So I think that where we are sort of kind of behind the eight ball as mental health professionals is losing that sort of value for therapeutic alliance, right? What I always say as a psychiatrist is that the most, and actually as just a healthcare professional in general, right? Outcomes are directly tied to whether your patient or your client truly feels that you care for them or not. They will tend to do better if they feel that you have their best interest at heart, right? And with the pressure that we have on us to see a certain number of patients, to make sure our schedules are full, I think that that gets lost in translation sometimes. And I think that we would do well, right, to just remind ourselves that even if we're seeing a patient for 15 minutes, just taking a few minutes to kind of see where that particular patient is in their life, maybe as simple as asking them how their holidays were, right, would go a long way. And I think that's what we've lost in medicine in general.
Yeah, I love that. I love that. Thank you for sharing. It's very thoughtful answer. If you had unlimited resources or unlimited time, money wasn't, you didn't have that pressure of, having to practice, what would you do? Kind of throwing you a curveball here with this question.
Wow.
If resources were unlimited, what would Dr. Munir, what would it look like for you?
If resources were unlimited, you mean as far as the business is concerned?
Anything. The world's your oyster.
I mean, I would probably, okay, so if I have unlimited resources, unlimited time, so I definitely have enough time to focus on the business and the growth of the business and the well-being of my employees, the well-being of my patients, I would probably travel a lot more. I would
Yeah,
probably travel the world, go to places that I've never seen before. I'm not big on those that sort of those big urban centers like New York and Dubai, but I love scenery, and I would probably see a lot more of the world from a scenic perspective than I do now.
I love it. I love it. See, it made you human. Here you are, this superstar leader and this really smart, psychiatrist. And it's like, no, I want to see the world. I love it. That is very authentic. So thank you for sharing that. All right. Final question. And really the microphone's yours. What would you share to, and you did earlier in the call, but what would you share to, the future psychiatrists or even med students and or leaders within a large mental health, association or practice? What words of wisdom would you share with people?
I would say, and I think that this has really been my mantra since I was studying for my USMLEs before I got into residency, right? Or actually, probably all throughout med school as well. Is look, you're going to face hurdles, you're going to face obstacles, there are going to be some bad days, right? But persistence is the name of the game, right? If you want to accomplish something, be persistent with it, and you will, if not right away, eventually accomplish it. So those would be my words of encouragement for our future leaders, our future physicians, right? It doesn't necessarily have to be psychiatrists either, right? It's just that if you want to accomplish something, if you're passionate about something, if you love something, be persistent with it and don't give up, because persistence is the name of the game. Ultimately, if you're facing a task like a pit bull, then ultimately it'll get done.
I love that. There was many times in my career as an entrepreneur where I wanted to quit. And it will happen. And you can't get to your destination or where you're going if you quit. So
Exactly.
I am so thankful looking back that I didn't on the days I wanted to, and there was many of them. So
Right,
I
of course.
agree 100% with that. Well, thank you so much for your wisdom and your insight and telling us more about your practice and yourself. It's been really an honor to have you. So thank you so much for being here.
You're very welcome. It was my pleasure.
Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.